Hey guys, quick question. Have you ever compared how early HIV shows up in men versus women? Here's the twist. Women often notice sooner, but men miss the most during the peak infectious window. Same virus, different early signals. Why? Which alarm hits you first? Swollen lymph nodes and night sweats, or abnormal discharge and burning pain? Most people develop flu-like symptoms 2 to 4 weeks after exposure, and that's when transmission risk runs high. U.S. Snapshot 20-25. In 2023, over 80% of new diagnoses were in men, about 800 of every 1,000 cases. Roughly 2/3 of all diagnoses were attributed to sex between men, the most affected group. I'm Dr. James, physician-scientist with 20-plus years experience. You'll learn 3 things: how early signs differ by sex, where blind spots supercharge contagion, and a 6-3 testing timeline plus a 60-second ritual that puts you back in control. If this hits home, share one sign you've ignored and subscribe. Your sub powers our first 1,000. Stay to the end for a trick to tell stress fatigue from an immune storm. Before solutions, let's make science simple. Guys, let me set the stage the way I did for a patient who joked in my clinic, "Doctor, are men and women really different, or is it all the same?" I'll answer in plain English, fast, so you can use it tonight. After exposure, the virus ramps up fast for 2 to 4 weeks, and many people feel a flu-like wave. That early surge is the window when transmission risk is highest, but the body's alarms don't blink in the exact same places for everyone. For many men, the first pattern is easy to misread: low-grade fever, scratchy throat, medium-sized neck or jaw nodes, a flat trunk rash, night sweats, and muscle aches. Because life is busy, guys often call it overwork, a tough gym cycle, or weather. Women often notice a different cluster centered in the pelvis: unusual discharge, burning with sex, recurrent vaginitis or cervicitis, and cycle irregularity. That draws attention sooner, partly because many women already track reproductive health as a routine. Why the difference in what we see? Hormones shift immune tone. The vaginal microbiome can amplify inflammation or protect it, and long-standing habits shape attention. Men are socially trained to power through minor symptoms. Women, for good reasons, tend to notice small reproductive changes quickly. Picture 2 breaker panels in the same house. The overload is the same storm, but different switches trip. In men, the breakers are skin, lymph nodes, and night sweats. In women, the breakers live in the pelvic tract. Discharge, odor shifts, burning, and pain. Same immune storm, different display. And when you mislabel the first signs as allergies, heat rash, or random yeast flare, you push off testing right when it matters most. Here's the bottom line you can remember without notes: exposure, early viral surge, flu-like phase, and sex-specific hotspots where alarms flash first. Understanding those hotspots is how you stop guessing and start timing care. If any part of this clicked, drop a positive sticker so I know you're with me, and tell me what still feels fuzzy. I update for you in real time so you don't miss what matters next. If you've ever thought, it's probably just heat rash, don't tap out. The next section will change how you scan your body each night. Before we sprint through solutions, take this section seriously, because roots decide outcomes more than any pill ever will. Back to the young man in my clinic. After I explained the basics, he fired off questions, and we mapped the real drivers together. First, stress and cortisol. Men often carry pressure quietly, chase caffeine, and pull late nights. That chemistry trains you to misread low fevers, sore throats, and night sweats as just a cold, right when early infection is most contagious. Second, lost REM sleep. When deep sleep fragments, your brain fog thickens, muscles ache, and motivation dips. Those sensations blend into the immune storm, so the signal looks like exhaustion, not a red flag that deserves testing and a timeline. Third, being sedentary. Long hours sitting cut healthy blood flow and raise background inflammation. Skin and mucosal barriers micro-tear more easily, especially with friction, heat, or alcohol on board, making entry points for trouble you never meant to invite. Fourth, culture and hesitation. Many men delay appointments out of pride or fear of judgment, while many women attend routine reproductive care and catch patterns earlier. Avoidance does not erase biology. It only loans anxiety more time to grow roots. Here is the message I gave him, and I am giving you. This is not aging. This is disconnection from body signals that were designed to protect you if you actually listen nightly and track them weekly. Now, reality check. Which roots do you recognize in your life today? Stress, broken sleep, sitting too long, or avoidance? Tell me in the comments so I can tailor the next modules to you and update what is still fuzzy. Where does the blind spot live? The place most people miss until it hurts? A small blind spot can open a very big door for transmission. Hey, I am speaking to you, my friend. The next segment goes deeper into you, into the blind spots almost everyone walks through at least once, and it matters more than you think. Stay with me. You will never scan your body the same way again tonight. Brother, tell me if the next 60 seconds describe your life, because for over 90% of men, it does. I say that after thousands of clinic conversations, where patterns repeat more than we like to admit. Hidden spot number 1 for men. A submandibular or neck lymph node, a little enlarged but painless, so you decide to give it a few days. You skip the mirror check, keep lifting, and the contagious phase keeps rolling while you wait. Hidden spot number 2. A flat, non-itchy rash across chest or back that looks like heat rash after a run. You write it off as sweat or detergent, and the timer on early detection keeps ticking in the background. Hidden spot number 3. Night sweats in a cooled room, which you blame on the blanket, the weather, or stress. You promise to hydrate and sleep it off, which feels responsible but isn't the action your immune system is asking for. Now, for the women in your life who might be watching, there's a different blind zone that steals time in a similar way. Unusual discharge, odor shifts, or burning after sex often get self-treated as yeast again, and proper HIV plus STI testing gets postponed. Think of your body as a high-voltage cable. Inflammation, micro-tears from friction, and shifts in pH or microbiome thin the insulation, and that thinner coat makes viral entry easier. The quiet consequence is simple and risky. The peak spread window overlaps with moments when both men and women feel confident enough to wait and see. I'm not here to judge you. I'm here to name patterns so you can beat them with clarity, not shame. If any line felt familiar, drop a comment that says, "Very real," and I'll know we're on the same page. Now, let's pivot without panic. A 1-minute nightly ritual can take the steering wheel back and hand it to you instead of anxiety. Don't go anywhere. If you're still with me, type "check me" so I know you're ready. Next up is the part people replay. 60 seconds, 4 checks, and a plan that turns the lights on when you need them most. All right. Focus with me and jot this down so you can use it tonight. We'll move fast because the method takes about 1 minute and repetition is the engine. The ritual is 60 seconds. See, sense, scan. Do it nightly, no excuses, and you'll catch small shifts before they snowball. Step 1. See, 15s. Stand under good light and check skin and rash zones. Scan chest, back, groin, scrotum, and foreskin if present, looking for flat bumps, redness, or new patches. Step 2. Sense, 15s. Use your fingertips to feel for lymph nodes. Track jawline, neck, armpits, and groin. Note size and tenderness compared with what normal felt like last week. Step 3. Scan 15s. Ask 3 quick questions. Did I sweat through the sheets? Did I run a low fever, and is my throat sore? Log 1 line in an app or notebook. Data over days beats memory over minutes. Step 4. Partner track 15s. For women watching or your partner, note discharge, odor changes, or burning with sex. If these repeat, book a visit instead of self-treating yeast again, and add STI and HIV testing. Now the testing timeline, the 60-6-3 rule. Within 60 minutes after a risk, clean up and go to a clinic to evaluate PEP within 72 hours. At week 6, get a 4th-generation AG-AB test. At month 3, repeat to confirm. Consider an early RNA test if anxiety is high. Practical safety is not theory. Use condoms plus lubricant to prevent micro tears, treat coexisting STIs promptly, protect sleep, and keep alcohol modest. Education note, not medical care. Nothing here replaces your own clinician. If you're worried tonight, book an appointment and follow professional guidance. Why does 1 minute matter? Because tiny daily measurements shrink blind spots, and timing is everything in early transmission windows. Commitment promise. If you practice 60 seconds, see, sense, scan, and follow 60-6-3 for 30 days, I promise you will miss fewer early signs, feel less free-floating anxiety, and improve the odds of timely detection toward a UU future. What did you take from this section, and what still feels unclear? Tell me below, because your feedback shapes the next updates and keeps this series truly useful. 1 minute each night for long-term control. That is a trade worth keeping. Let me show you why this 1-minute ritual works, then tie it to 2 real clinic stories. A young man and a young woman who came in the same week. You will hear biology in plain English and how small habits change outcomes. Mechanisms are simple, but results are profound when you are consistent for 30 days and honest with what the notes reveal. First, the autonomic nervous system. A short, calm ritual with slowed breathing nudges the parasympathetic branch to the front seat, lowering cortisol and dialing down the body's background noise. When noise drops, weak signals, tender nodes or subtle night sweats, rise above the threshold you notice. Second, tissue barriers and microbiome. Correct lubrication and gentle technique reduce friction micro tears that thin your insulation, while timely STI treatment cools inflammation that otherwise invites viral entry. Keeping insulation thick is like weatherproofing a cable before a storm. Third, measurement as medicine. 1 nightly line builds a timeline your brain can't fake. Patterns pop. 3 nights of soaking sweat, a new trunk rash, or nodes that feel bigger than last week. You stop arguing with memory. You act on data. Case 1. A 27-year-old man with a faint chest rash and small groin nodes. He started 60-6-3 that day, tested at week 6, confirmed at month 3, and entered care early. His viral load crashed. He reached undetectable, UU, and his confidence returned. Case 2. A 24-year-old woman with recurring discharge and burning after sex. Instead of another over-the-counter yeast round, she booked HIV and STI testing, treated what was present, and symptoms settled. Her partner tested and treated too, closing the loop. That's the engine. Calmer nerves, stronger barriers, and clear records that turn guesswork into timing. The ritual makes the invisible visible before it grows teeth. Now, what chain reaction should you expect? Better sleep, steadier energy, and fewer false alarms prime the body to heal in ordinary ways you can feel within weeks. So, do you see the male-female difference more clearly now? You're thinking in the right direction, but it gets sharper in the next section, written directly for you. Stay with me tonight. Skipping it would be the real risk. Have you felt anything yet after trying the 1-minute ritual? Try it tonight. Come back and tell me what landed, because feedback sharpens the next step. 2 weeks in, that same young man returned to my clinic smiling. He said the changes were small but steady, and they stacked up in ways he did not expect. Sleep came easier and stayed deeper. He stopped waking soaked, and he stopped scrolling at 2 a.m. Morning energy felt clean, not jittery, and coffee became optional rather than oxygen. With a clear plan, his mind quit catastrophizing. He spent less time Googling symptoms and more time living. Conversations with his partner softened, because honesty replaced guesswork, and there was a calendar both could see. Skin flare-ups thinned out. The rash patches faded, and shaving bumps calmed down. His digestion steadied. Bloat eased after dinner, and gym recovery stopped feeling like a second job. For women following along, recurring irritation eased once testing and targeted treatment closed the feedback loop. When inflammation cooled, the body's insulation thickened again, and comfort returned to ordinary routines. Think of it like unknotting a cord behind your desk. Release the right knot, and the whole line moves freely. Gunk you thought was permanent was tension and neglect. This is how small, boring habits heal loud problems. The ritual corrals uncertainty into a page, and the 60 to 6 to 3 timeline turns fear into appointments, which turns waiting into action. When body and mind settle, your presence comes back online. You notice humor again. You make stronger choices in the moment, not from panic, but from ownership, and that confidence sticks. Would you want this arc for yourself? Many patients tell me it is what they hope to feel but could not describe. If this section helped, drop a comment helpful, and tell me which piece felt most true. Want the 1-page PDF for the nightly ritual? Comment checklist, and I will get it to you quickly. When body and mind feel aligned, resolve returns. That is the momentum we build next. And if you're still here with me, I'll say this clearly. You've already won. You know why? Because just reaching this point means you've done what most people never do. You face the truth with calm eyes instead of fear. Much like the 60-second ritual, this mindset isn't about perfection. It's about daily consistency, small accountability, and reclaiming your sense of control. That, my friend, is confidence built from action, not from theory. For men, this moment is about shifting from silence to smart confrontation. You've spent years powering through pain, ignoring signs, convincing yourself it's nothing. Now, you know better. That 1 minute of nightly discipline, the See, Sense, Scan ritual, is not a chore. It's self-respect, the highest form of masculine dignity. Discipline becomes self-worth in motion. For women and partners listening, your strength lies in listening to your body without shame. You protect yourself not from fear, but from knowledge. The couples who follow Talk Test Trust don't build walls. They build confidence and honesty. That trust creates safety deeper than any promise could ever reach. 1 minute each night plus the 60 to 3 testing rhythm equals true control. It's the formula that quietly transforms anxiety into awareness, panic into preparation, and isolation into partnership. The young man I mentioned earlier told me this after a month. I didn't just feel healthier, Doc. I felt real again. That's the rebirth I want for you. Clarity that expands into every corner of your life. If you've made it this far, it means you're ready to act. You're ready to turn reflection into routine and fear into forward motion. That readiness is victory. That mindset is healing. So, take this evening and start. 1 minute, 1 ritual, 1 act of care. And when you wake tomorrow, remember, you already began the change last night. Now, let's wrap it up. Let's summarize everything you've learned so you can begin tonight with purpose. I'm grateful you stayed with me. Your attention fuels this mission, and it tells me these conversations matter. Thank you for trusting me tonight. Here's the summary. In men, early alarms often hide neck or jaw nodes, flat trunk rashes, and night sweats that seem like just stress. In women, pelvic changes, discharge, burning, recurrent irritation tend to surface sooner. The shared blind spot is mislabeling. People call it a cold, a detergent rash, or another yeast flare, and that delay costs the most. Early windows reward action, not waiting, because timing turns doubt into detection. Your nightly plan is simple and steady, workable. Take 60 seconds to see, sense, and scan. Then use the 60-6-3 timeline, cleanup and PEP evaluation quickly, a fourth-generation test at week 6, and confirmation at month 3. Our treatment goal is clarity and control. When care is correct and consistent, undetectable equals untransmittable. You is not a slogan. It is the outcome we aim for together. Choose one move tonight. Do the 60-second ritual before bed, or book a week 6 test if a risk is on your mind. Pick one and let momentum carry you toward calmer mornings. Share this with one person who needs peace. Knowledge spreads safety faster than fear spreads silence. Your share might be the nudge someone hoped for all week. Subscribe if this helped. Each subscription builds a library of practical, judgment-free guidance and moves us toward our first 1,000. I notice every milestone, and I'm grateful for yours. Thank you for staying until the end. Your presence keeps this work honest, compassionate, and useful. I'm honored to walk this road with you. Education only, not personal medical advice. If you've had a recent exposure, seek care now for PEP within 72 hours and follow testing and treatment with your clinician.